So finally, let's hear from Michael Petersen with Ware Malcomb on their design for health and wellness campus of the future. Ware Malcomb has envisioned a mixed-use medical campus that includes 4 primary components: mind, heart, spirit, and body. The space is devoted to telemedicine and collaborative teamwork that delivers healthcare to patients both on-site and remotely. Michael, you want to walk us through your design?
Thank you. Welcome. So, as we all know, healthcare is experiencing sweeping change. So where will this take us in the future? What will the medical office of the future look like? So the factors affecting healthcare change are complex and many. Legislative, technological, social, and economic pressures all play into the change. But what factors might most affect the built-out physical environment of the medical office? As part of our research, we invited industry experts to participate in a focus group session to explore just that. And as the findings of that focus group, plus our own research, we were able to identify 3 major factors affecting the future of medical design. The first being mobile technology, the second is advances in medicine, and the third being social media. Collectively, these items taken together under the notion of more health, less care as we move forward. So the first factor, mobile technology. In a world of always-on technology, constantly monitoring our vitals and our activities in daily routines, coupled with easy, almost instantaneous access to healthcare professionals via Skype or even microclinics where we all live, work, and play. Those factors will combine to transform how we design medical space into the future. Here's an example of a medical suite. What this does with the amount of virtual appointments and consultations we'll have will reduce the need for as much exam rooms that we'll need in the future in favor of more consultation space. So with fewer exams, because we'll be getting checked up constantly through our personal devices. With less exams and more consultation space, we'll be able to have more office space for staff that will be dealing with those consultation calls and virtual visits. Here's an example. The exam spaces are kind of in the background between those 2 blue elements, but it leaves a lot of extra office, very flexible, open, collaborative space for staff. Kind of brings maybe the notion of office back into medical office. The second factor being advances in medicine. Science marches on. Progress in the fields of gene therapy, nanotechnology, robotics, and customized drugs, each will have the capability of treating ailments on a molecular level. That, coupled with advances in 3D printing technology, pardon me, will transform how procedures are done in the future. It will continue to see the ushering of more and more procedures out of the hospital and into the outpatient environment. Skipped. Okay. The result is a outpatient procedural suite with a smaller footprint than what we're seeing today. By using on-site 3D printing, and that would be for synthetic tissues, organs, equipment, parts, anything needed for the cases of the day, along with using drones to courier supplies and specimen samples to and from labs. Those 2 combine to reduce the footprint of required storage of supplies and materials on site, and also allows the procedure rooms themselves to be much more flexible because everything is provided on demand. A side benefit to this is that recovery bays, there'll be less demand for recovery bays in the future as most procedures will become non-invasive. Here's an image of the procedural suites off to the left. Very open, clean, highly technology, with some 3D printers in the foreground ready to go in the central core. The third factor being social media. Social networks will continue to pressure healthcare systems in providing more and more transparency and accountability in their business model. This in turn will continue to fuel the competition that we see among health systems to provide more and more amenities to their care system, to their members, including more hospitality, retail, and other amenities into their services. And I mentioned members before. I think that we're going to be seeing and hearing not so much the word patients in the future, but more members to a care system. Our solution addresses each of these factors in a concept of the mixed-use medical campus, bringing together wellness, health education, clinical treatment and therapy, and outdoor amenities, along with hospitality and retail elements in a facility designed to nourish the hearts, minds, bodies, and spirit of the community it serves. So for a little detail, the yellow here, this is the heart nexus, which will provide preventive care services in a wellness center setting. Features can include fitness centers and integrated medicine and health spa. We could imagine an indoor rock climbing wall here, swimming, weight training, yoga, any of the activities you might expect in a fitness center. The Mind Nexus will provide resources for personal and social growth, including learning center, conference center with classrooms, and spaces for group therapy. Features here include potential library, a community hall for public gatherings, and even classrooms might be fitted out for demonstration kitchens for healthy cooking lessons. The Body Nexus will provide patient-centered care and services, including physician offices and consultation suite, similar to what we just discussed a minute ago, treatment and therapy programs, especially as it pertains to patients dealing with chronic conditions, and our outpatient procedural suite, again, that we discussed a second ago. Outdoor amenities provide rejuvenation to the spirit throughout the site. Here we have illustrated the elevated skywalk, which leads to the observation prow at the top end of the diagram. Below it, in this circle area, is the meditation pad and healing garden. And a little bit midway there on the left side is a small cafe where visitors and family might take a break and wait for their loved ones to undergo treatment. All of this comes together in a design inspired by nature, providing a hub of healthy living in its neighborhood. I have a short flyby animation to share. So even though that this animation appears to be in a field of forest, the siting is actually in a suburban context, serving an interconnected series of villages comprised of residences, schools, parks, local shopping, and neighborhood amenities. Regarding sustainability, the facility is designed to achieve net zero energy efficiency through the use of advanced features such as a smart roof inspired from the automotive industry, which combines collection of solar energy and cell signals in one material. So in designing with durability, efficiency, flexibility, and sustainability in mind, the mixed-use medical campus is what we feel to be the future of medical design. That brings us just about to our end. Thank you.
Good job, Mike. Man, he did that one in with only 3 seconds to spare. Great job, Mike. Technology, big data and analytics, community-based ambulatory facilities, and the rise of consumerism will transform the healthcare market and delivery systems. And clearly there's a role for our industry to play in that, because we're going to see a lot of new buildings that are going to have to be built in that area. So I like the Ware Malcomb design, because not only did it deal with the holistic care nature, but it also looked like a cool place and looked like fun. So that's the architect in all of us.